Okay, your government also made a commitment, $4.5 billion in terms of an annual for permanent transfer for mental health and substance use. You know, there's $875 million that still hasn't been spent on the promise so far to date. Meanwhile, we're in a crisis, as you know, when it comes to mental health. Now, the recent healthcare bilateral agreements with the provinces and territories, it provides temporary funding of $2.5 billion annually to be divided into 4 priority groups, one of which includes mental health. It's far from what you promised in the transfer. And now, with multiple coinciding crises, facing emergency department closures and health human resource shortages, why has your government significantly decreased its funding commitment? We've got a toxic drug crisis. We have a mental health crisis that's happening in our country.
Thank you for that question. I have to say we are investing in mental health, and we know that a very important agreement is happening right now with provinces and territories to make sure that we deliver on mental health care across the country.
I think we need some more transparency because we don't know what's in those agreements. We need to know. People need to know. We're far below like our peers, and when we look at France and Britain that are at 12% spending on mental health. In Ontario, it's 3%. In my home province, it's going to be closer to 9% with the recent $1 billion commitment from the EB government. We need the federal government to step in and ensure there's parity with physical and mental health.
Well, I was in my writing this week.
I had a parent just write me, and his son is addicted to fentanyl, and he said that he's going to have to sell his house because his son's in treatment. Now, if his son broke his neck, he'd get covered. Mm-hmm. He shouldn't have to sell his home to save his son's life. That shouldn't be happening in a country like Canada. And I hope that you'll fulfill your commitment.
We are investing important amounts in mental health. And
Minister,
I know that in my writing, if I may, in my writing I was at Recovery for Care this week. Important amounts for safe supply has been also
Minister,
invested in communities.
Minister, you're spending $33 million a year on your substance use assistance program. That's peanuts for how many lives are being lost.
We are investing.
People are dying. You're not acting like it's an epidemic that it is. You've never invested so low on such a health crisis. SARS. You can name every health crisis. The HIV epidemic, the COVID. This is a drop in the bucket for how many lives are being lost.
We should also recognize that the federal government, the current federal government, has invested incredible amounts during not only the COVID pandemic, but also
if you spent 1% of what you spent on COVID,
I'm sorry, that is our
1%.
time.